They experienced high levels of stress and anxiety. They exhibited the highest degree of professionalism. They bent out to save lives during the COVID-19 pandemic. 7,200 of them got infected with the disease. 18 of them lost their lives. My colleague Sarah Penko tells the story of the unfortunate heroes of COVID-19, healthcare workers.
With no prior experiences of a pandemic, they remained resolute. It was a difficult moment for them as they saw both patients and colleagues succumb to the disease.
As we're losing very senior doctors, it put a lot of anxiety and worry in the general membership. We were very sad to lose people who were training us to this pandemic, and that in the midst of the uncertainty, doctors who got infected suffered isolation. Some had to treat themselves at home. Some were taken to isolation centers, and then sometimes realized how lonely the path could be. There were situations where you yourself, you return home and you cannot mingle with your family. Doctors had to relocate.
Though about 6,700 nurses got infected, the Ghana Registered Nurses and Midwives Association believes the figure is underreported. National Coordinator for Severe and Critical COVID-19 Cases, Dr. Chris Owu, noted prioritizing healthcare workers in the vaccination drive had averted more casualties.
A few doctors, a few nurses around the country who contracted COVID. A majority of these were in the first and then second wave. Majority of those have been people who were not vaccinated. Now, in December, when we had the fourth wave, which was predominantly Omicron, a lot more people did get infected, and this was quite remarkable because prior to the fourth wave, we could boast of just a handful. We could count the number of the doctors and nurses who had ever been infected with COVID, and every single one of those, none of them were severe.
They are certain the lessons learned will make them stronger.